So this is supposed to be the second vlog for October. Sorry it's so late. Had some technical difficulties with my phone. So last Thursday is just for record. It's Wednesday. I'm from this. Last Thursday I got a call saying they want me to go back in, but only to send to Rhode Island for that procedure that I was supposed to have back in last month in September on the 22nd. That never happened because the BMI was too hard to do the outpatient. So I'm getting ready to waiting for my mom to pick me up to go and have it. Keep you posted. So I just got out of the procedure. I'm finishing up in recovery, just waiting for my mom to come on and pick me up. So far so good. Don't do results yet, but keep you posted. So I'm at my parents' house recovering from my procedure. Sorry. Part of the procedure, it was an endoscopy, upper GI endoscopy, so I had to have two stomachs thrown into my stomach, so I have gas bubbles now, so excuse any noises, so to speak. The doctor said so far they're good, but they took some biopsies, had to wait for the results of that. I got to the hospital, to check in at 10:30 a.m. Didn't get taken back until like after 12:30. Pardon me again. Didn't get out and have my phone know what time it is until like 1:30, so probably was like 1 o'clock by the time I got out though, with in recovery. But my doctor was very nice. If you ever have to have an endoscopy or the other end of one, and you live in Rhode Island and you have lifespan, if you get Dr. Penza, he's really good. That's who I had. I went to Rhode Island Hospital for it this time around. Long story behind that one, but the anesthesiologist was great. The nurses were great. Long wait, but everybody was great. And they only used my legal name, but they also had it in the notes as my nickname and what I prefer to be called. And they did refer to me as that. But my nickname was just Bloom, for those who don't know. And the fact that they used my nickname when they could was wonderful. Felt very respected. Treated me like any other patient in spite of being legally blind and autistic. So other than that, I was treated like any other patient, but maybe a little extra care because of the disabilities, but like not like talking down to me either, talking to me as an equal, which I respect. Doctors who do that. Doctors who talk down to me can leave, honestly. But we did in the recovery room for a little bit. Then my mom was called, who was my ride in and is my legal guardian. She went to get her car, pulled up front, and called me to let me know so it was out front to have them bring me down. And sorry. And now I am recovering at their house. That had some toast and working on some ginger ale. They did give me some Laura Nunes and some oranges as what I chose out of the choices of cookies and stuff that I had and the drinks. Had to go granola bars on the way home too, and some water, but didn't want to spoil my dinner because as soon as my dad gets out of work, which is why I can't be quiet, he's working, so but as soon as he gets out of work, we're going to, I forget the name of it, it's a country club with a golf course near my parents' house in Warwick, Rhode Island, near that Warwick High School. If anybody knows the name of that golf club, let me know, but we're going there for their Wednesday deal, which is a burger and beer, which I'll just have soda, to be honest, because I'm a big beer person, plus Dr. George knows alcohol for the next 24 hours, so be a good girl. Save the money anyway. But, yeah, I'm doing okay. A little tired, but not as much as I was before, so continue to keep you guys posted. So it's now Tuesday the 26th of October. I had the procedure done last Wednesday the 20th of October. So the endoscopy, so the scope didn't show anything. So waiting on the biopsies, might not get until next month. You know how the healthcare takes. It takes forever to get anything done. But I've been dealing with this stuff since like March. Like beginning mid-March is now basically the end of October. So yeah, do the math on that timeline there. But since I woke up in the recovery room for the answers at 1 o'clock on last Wednesday, so 6 days ago, my fingers, all 10 of them, and all 10 toes, have been ice cold. They're not cold to the touch. My pulse is fine, but they were cold. I thought nothing of it at first, but then Thursday came. Like, okay, it shouldn't have lasted this long because I didn't thought it was the anesthesia. Called my doctor, had an appointment with her via telehealth medicine, so video chat for video. To give some tips to call her back Friday, which would have been the 22nd. Yeah, so yeah, that never happened. Yeah, I got busy doing chores and stuff. And by the time I realized not only was the time she wanted me to call back done with, the place was closed. The office was closed, so I had to. And I thought, well, maybe by the time the week comes around again, I'll be better. Saturday, not better. Sunday, not better. Monday, went to the day program, was still not better. Monday afternoon, got to my parents' house, still not better, so I called the doctor's office. Made an appointment for earlier today, this afternoon, with 2:45 appointment. I went to my day program today because I woke up still not better, by the way. I went today, got dropped off by my day program, waited a little bit, got taken in. So things that some autoimmune disease called, I can't pronounce it. I have it written down, but it's because I've been legally blind, autism. Try to be the cause of really legally blind with autism. Try to do it with one problem, one of the two problems, alone the two. It ain't an easy task. But so since this autoimmune, so I had just had my annual a few weeks ago, so he got all his blood work, but they didn't order the blood work that would test for this, so I had that ordered. Also asked about getting speech therapy because speech has gone downhill in the past 8 years since I finished high school. Well, I graduated a year late, plus not just my freshman year, but even my second year, but my post-grad year, so 2013. Who cares? I finished, whatever. But so since spring 2013, I haven't had speech. So like 8.5 years. So she's gonna look into that, but she also ordered the blood work. Luckily, where I get my blood work done is like she's on the third floor of the building. The bottom floor is the back entrance, by going to the second floor. And I had to pass, and one of the offices done it is the blood center, so I literally had to pass the blood center, like the blood drawing center, to leave. So I was like, I had to pass it anyway. Might as well go in, get it done. Plus, my mom would pick me up. I wasn't expecting her to till 4, and this is like only 3 o'clock or so. Maybe 3:30 actually by this point. Because the appointment was only at 2:45, so it's probably like 3:30. Got in, waited maybe like 6 minutes to be checked in, 2 minutes check-in, another like 4 minutes waiting, and the 2 minutes waiting, 4 minutes to get it done and get better. I passed out, so I had to have the one to the bed. Luckily, that was the one they told me to go to. Got the blood drawn, and apparently I know the people there who work there. I've been going there since I was 16, so that's 12 years. There's one woman who's over there who was there today, who was the one who drew my blood, who's also the mother of a friend of mine. I won't say either of the names out of respect to them, but she tried to drew my blood, which actually helps the process, to be honest. Honestly, it does help. But by the time I got out, waited a few minutes. It was like 3:30 something. My mom was only supposed to get out of work 3:30, so I called her at 3:40, like I usually do, saying, "Hey, on the hallway waiting when you get here." And apparently she had left early, so she was like 5 minutes away. Because there's usually a bench right outside that door, near the outside doors. But they took it away. Guess why? Here you go, pandemic. So yeah, so let's make the blind girl who can barely get out, who can sometimes barely stand up from a regular chair, here seat, get on the ground. Yeah, let's put the blind girl on a spot on the ground while she waits for her ride, and have a hard time getting up. So the car, put her phone away, get up, and struggle to grab her purse, grab her lunchbox because he was at her table, she had to have a bag lunch, and grab her cane, get her mask and stuff ready out. No, wait, not mask. I was having it on, but step outside and take her mask, purse or half off to put her mask away, and wait for her mom. Like, honestly. But so I did that. Just got results. At least of one of my forget the name of it now. One of my test results. The health was it was way above average. Let's just say that. It's like what does like my mom described it as like swelling factor. So it's whatever describes the swelling factor, which is, hold on, let me look this up. I'm gonna go on to my chart. So hold on, I put in my secret code to get in to look this up. Sorry, I had to put in my secret code. Now they're gone to my test results. Okay. Oh, I got more results in. Good to know. So it's called my SED rate. That I was looking up earlier. Average is 0 to 20 for SED rates. It should be the 0 to 20 range. I'm at 65. 65, and average is 0 to 20. That's way better. That's not good. Because I just realized I have new results. The other results from the other test must have come in. So, yeah. There's one here called CRP, which it looks like average is 0.00 to 10.00. Once again, way too high. Over 18 point, not gonna finish the rest, but 18 point double digits. So that's way over. Yeah, it looks like I'm over in a lot of things. Some of this looks average or slightly over. There's a few things that are slightly under. Season slightly over, but mostly in the what's called a complete blood count, or no, white is called it's an autoimmune deficiencies of or CBCW, and some of it is just an average, and some is just out of just high, and a few things are just a little low. Well, depending on what you mean by little. Take your pick, depending on what you call little. But, overall it looks not horrid. Oh, hold on, no, I don't know much about blood. I have to ask the mama, since she tests blood for livings. And, my vitamin B2, that's what she really wanted to test. Let's see what that is. Yay, okay, normal range. Not exactly in the middle, but good enough. And this last one, I can't pronounce it. If anybody knows what FOLATE in blood work is, please let me know. And I'm not going to worry about it though, because it's in the average range. But yeah, did this have to figure out why my fingers and toes were cold, even though nothing else could seem out of place. Of like the blood flows good to it, so you could tell they weren't cold to the touch. But she thinks this is autoimmune disease that is actually very common in women my age, and have autism, and autoimmune disorders are quite common in people with autism. So since I'm an autism female in my late 20s, the fact that I have autoimmune disease that's common in women in their late 20s should have been, it shouldn't be too bad, too unexpected. But the fact that it was like dormant, and if I never had an anesthesia, if I do have it, and that if I do end up having it, it was only triggered by the anesthesia. If I had never had an anesthesia, maybe it would have never been activated in me, but who knows. And I'm trying to read the name of this disorder. This disorder is Raddy's disease or something. Trying to read this. Small paper, small writing, legally blind. Like I said, it's not easy. But so yeah, that's what's going on with me. That's what's been happening so far. That's the update. So I really want to get you guys the information on the name of this what's it called, autoimmune disease that the doctor thinks I may or may not have. Okay, I think that's a RAYN, right? RAYNAUDA as I think Radon's disease. Is it pronounced Radon's or Radon's disease? I guess it's what I'm losing my words, but immune deficiency disorder, right? Radon's disease is immune deficiency. So, if you know anything about it, please feel free to let me know in the comments. But I'd love to learn more just in case it is this. And I guess that's all. See you in the next vlog, and remember, be kind, be yourself. Don't let people who are not in your inner circle bug ya. Be kind to yourself, me, and the others in the comments. And if you like this stuff, please like these videos, and if you want, please subscribe to the channel. It'd be very much appreciated if you aren't one of you who are already, and maybe hit that little notification bell, so you can know right when I upload.